beautiful people, welcome back to my YouTube channel. I'm Tato Masite, as y'all know, and guys, I feel like the family is growing. I have like 72 subbies. 72 subbies, guys. I know it's hard. Hey, it's very hard gaining subscribers and everything like that, but the little that I'm getting, trust me, I'm very grateful. Sometimes I don't even know who subscribed to my channel, but then I'm like, much love from me to you guys. So to the returning subscribers, welcome back to my YouTube channel. To those who view on a regular but have not subscribed, what are you all waiting for? I mean, if you like the content, if the content is dope for you, you can subscribe. You know what to do. Just hit the subscribe button and you're good to go. So, vandaag ek wil praat. Now I can say ballet guys. I'm going to talk about Pap Smears. Pap Smears. And this video was inspired by Nonhlanhla Mabawa. She asked me to do this video because she wants to know more about Pap Smears. Okay, so what is a Pap Smear, guys? Okay, we all know that getting a with us ladies or with us women, Pap Smear is common. Not Pap Smear, man. Cervical cancer is common, and that's the main reason to do a Pap Smear. The risk factors of you getting cervical cancers would be if you've had sexual intercourse at an early age, maybe your menses started around 9 or 10, like you started your menstruation at that time. Or again, guys, we must be very aware, male people are the most carriers of these type of things, especially males who are not circumcised. There is a lot of bacteria that stays in the foreskin, and that bacteria, when you have unprotected sex with that person, that bacteria gets transferred to you. Guys, don't mind the ring, I'm not engaged, I'm just playing with it. Anyway, so if you have unprotected sex, it's very common for you to, like, the male foreskin has a lot of bacteria around it. So when you have unprotected sex, that foreskin, obviously it's gonna retract, and all the bacteria is in that foreskin, because some people don't know how to bath their foreskins. This is a very uncomfortable topic, but I'm a nurse. I can do this. Some people don't know how to bath their foreskins. Like, guys, this chair is very uncomfortable. Yo, let me adjust my chair. Yo. Okay, I think my chair is good to go, so I'm also good to go. Now, those bacteria on the foreskin will get transferred to you, and sometimes they cause HPV, human papillomavirus. I think that's why young girls, before they reach the age of 18, I don't know if the private sector has started practicing this thing of giving HPV vaccines, so that, because I know mostly young girls, before you reach the age of 18, you get these HPV vaccines so that they can prevent you from getting HPVs and also decrease the risk of you getting a cervical cancer. So I don't know if the private sector has upped their game and like, we're going to give HPV vaccines to everybody. I don't know about that. I haven't researched about that. If I do, okay, before I post this video, I'll just write it down on my description box just to mention that I did research about it and this is what I found, you see. So the reason we do a Pap Smear was invented by this guy. I forgot his name, but he has a pap in it. His name has a pap in it. So he invented this thing. So a pap smear, you do it, depends on are you a high risk or not. Before there were consolidated guidelines or updated guidelines on how to do a pap smear, or actually when to do a pap smear. We knew that we do a pap smear screening every year, but no, not really. It depends if you're high risk or not. So I recently went to my gynae. I did my pap smear. I did it when I was 24 first, and then she was like, no girl, you're too early, but we'll do it because you're here already. So she said to me that a pap smear, according to the consolidated guidelines or the updated guidelines, you're supposed to do it from the age of 25 going up. So by the time you do a pap smear, sometimes it also goes according to the risk factors, okay? So if you have a family history of cancer at home, regardless it's breast cancer or whatever, it's very important to screen yourself for these things so that you can prevent it before it goes further, and so that you may know what's happening in your body. And I think I'll do a breast exam soon, a breast exam video. Why we do breast exams? Like, I'm getting so excited. Anywho, and then if you're not a high risk, they advise that you do a pap smear once in every 3 years or 5 years, depending on you. You know, sometimes you do a pap smear and you're like, I need another one. It's up to you guys. If you feel you're at risk, if you feel you need to check yourself and you need to be sure of what's happening, do your pap smear. Pap smear is I don't know if I should say it's painful or uncomfortable, because it depends. If you're gonna fuss on the bed and not stay stable and relax and take deep breaths, it's gonna be very painful. But if you just relax and I know it's impossible to mind your business when people are busy on your cervix and but anyway, so if you are HIV positive, they advise that you do your pap smear every year, because you know, when you're HIV positive, your immune system goes down, and every not to say your immune system goes down because you're on treatment, but your immune system goes down because now it doesn't go down. You're at risk because of the virus itself. The HIV virus. Yeah, the HIV virus. You're at risk because of the HIV virus. So it's important that you do your cervical pap smear every year, just to rule out the fact that you may get cervical cancer. Okay, so this video is a mumble squabble. It's mixed up. It has mixed emotions because I was not prepared. But then I thought, let me just do this video and see how it goes. So when you do a pap smear, be it you're doing it at a private practice or you're doing it at a public practice, it is important to know these things. Ne? Immediately when you enter the practice, be it private or public, be prepared to be asked your last menstrual cycle. Do you have any children? Is there any risk factors at home that may put you at risk that may be a highlight of you maybe being at risk of getting cervical cancer or any type of cancer? And if you're sexually active, do you use a condom? Do you not use a condom? Are you using contraceptives? Which contraceptives specifically are you using? Those type of things. Your gynae or the sister that's seeing you is gonna want to know these things. And this is done so they can get like a better understanding of you, or understanding of your reproductive system at large, which involves the uterus, the cervix, the fallopian tubes, everything like that. So they're gonna want to know that. And then don't be shy to tell your gynae or the sister, I don't know, I'm sexually active, I don't use a condom, or I'm sexually active, I use a condom, but I also use contraceptives, what. It's not shameful. It's not shameful. We are there to help you. We are there to help you figure out as to what's happening and get a better view of your reproductive health, you know. So it doesn't help you lying and then the next thing the results come back and it's a shocker. Now that's when you want to tell us the truth. It's better to tell the truth from the get-go so we know what we're dealing with, you see. And then a bed is gonna be ready for you. They're gonna put up a bed for you, and then obviously you're there for a pap smear. Don't go do your pap smear when you know that you're gonna cause problems for your gynae or the sister. You are there for a reason. You know why you went there, to get a pap smear. So they're gonna you're gonna take off your pants and your undies and whatever. You're gonna lie on the bed. They're gonna give you a towel or something. And obviously, there are tools that we use to do our pap smear. We have a Gasco, the Casco, whatever. There's metal and there's plastic. So I'm gonna put them up for you, so just so you can see what we use. We have Gasco, there's metal and there's plastic, and there's a way that we use it. Obviously, as you're lying on the bed, the Casco, it can open so wide. But we don't let it open that wide when it's inside you. We open it to a point that we can see, at least we can see the cervix. So obviously we cannot rely on your vaginal fluid to lubricate that foreign substance you're about to introduce inside your vaginal canal. Vaginal canal. Yes. So we're going to use a lubricating jelly just to make sure that the thing can slide up into your vaginal canal, and then we can get a better view of your cervix. Mind you, pap smear is not a whop thing. We don't just... We need to know what we're doing. We need to be thorough. So you're going to take your casco, insert it. I'll show you the pictures. Don't worry. Just, yeah. Pictures will show here. So we take the casco and insert it into the vaginal canal, and then we just make sure that it opens as wide as it can until we can see the cervix. So the cervix is just a small, and I think it has like an opening. Obviously, that's where the dilation happens when you're about to give birth and whatever. So there we have to check if it's red, if it's inflamed, if there are any signs of infection, any pus coming out, anything that doesn't fit there. We have to note that. And then obviously we either use a spatula or we use a brush, a cervical brush. So I've used both. I've used the wooden spatula, I've used the cervical brush. And then when you use a wooden spatula, it's not that most of patients that I've done a pap smear on, they don't complain that much, because it's just contact with your cervix and you just spin it. Do you spin it? No, you don't spin it. Just insert it on the mouth. That small opening, and then you gather your... I don't want to say specimen, but you gather the specimen, and then there's a glass that we use, a glass slide. We just smear it on the glass slide, and then we have a fixing spray. We just spray with the fixer, and then we put it there. We label it with your details and everything, and then usually when you're working in a private government sector, government sector, we usually tell them to come back in 6 weeks, because that's how long it can take for the results to come back. And then if you're using a cervical brush, we have this bottle longana. It's a fluid. There's a fluid in it. You just insert the brush. It has to touch the cervix and the opening. You just spin it 4 times, take it out, and then it's so cool. It's just like you rinse it in that water, and that water, it's not water per se, but you know what I'm saying. That water is the one they're gonna use to analyze everything. And still, regardless, when you're at the government practice, they're gonna tell you to come after 6 weeks to get your results. If you are at a public practice, a private practice, there's a possibility that your gynae is gonna say to you, you can come back, or you're gonna hear from me in 2 weeks. So it doesn't take that long, advantage. Things are more escalated in the private practice than in the public. So all I can tell you is that honestly, doing a pap smear isn't painful depending on you. It can only be painful if there's something wrong. Listen, I went to do my pap smear recently. Ne? My first pap smear wasn't that bad. It was done. I'm like, oh, okay, that was chilled. My second one, yo, guys, I felt like I was dying. I don't know what my gynae was doing. I hope my gynae doesn't see this or something. Should something happen in the, I don't know. But it was so painful. I don't know what she was doing inside me. I don't know. I felt like I could scream, honestly. It was uncomfortable. It was painful. I'm not gonna lie, because I want you to know. Okay, I'm gonna tell you because I'm telling you my experience. Some people's experience are so chilled. You just go there, whoop, whoop, done. Some, it's kind of painful. So for me, the first time was good. The second time was so painful. Like, I even went home like, oh my goodness, what's happening? I felt like my uterus was just gonna fall out because it was so painful. But then my results came back fine. Everything was fine. I don't think I have high risk factors. I don't know anybody who has. I don't know. My grandma didn't have cancer. Nobody had cancer at home. So I was just checking for the sake of my reproductive health and so many things. Reproductive health doesn't necessarily mean the contraceptives. See, Pap smear, it's a whole branch, especially when we start talking about abnormalities of the cycle, the endometriosis. So many things, guys. There's so many things that we can gather from reproductive health. But honestly, a pap smear is very important. If you feel the need to do it, go do it. If you feel you're not ready, it's fine. But eventually, if you are high risk, do it. It's good. I feel like it's better to feel uncomfortable for that moment than to come at a later stage where everything is just bad and you are progressing and there's just a lot that's happening. Maybe they find cancer or whatever. But just to be on the safe side, do your pap smears. Don't get scared. If your gynae or the sister that's working with you can reassure you and you work well together, I don't think the experience could be that bad. So I'll show the pictures, everything. Or I've shown them already. I don't know. But all I can tell you is that pap smear isn't that bad. It isn't that bad. And if your results are normal, it's not really necessary to do it every year. But if you feel skeptical, you can do it. It's up to you. But talk to your gynae, talk to your sisters at the clinic. Guys, a lot of people are complaining, oh, yo, my sister go clinicing. Yo, these sisters are so terrible. Yo, these sisters can just mock you. But yes, I know. But at the end of the day, you're gonna meet that one sister. When you come across them, they're so welcoming, they're so friendly. You feel at home, and you're like, I'm gonna open up to this person. It's not every day that you meet a sister with shoutang and everything like that. So, pap smear are a necessity because we don't know. We don't know. We don't know these people. We don't know these people. Sometimes you meet a guy they sleep with a lot of people and they can just carry those germs and just deposit them into you, a whole lot of them. So it's important to take care of your reproductive health, because when things get bad, you're the one who suffers. The guy doesn't even have a problem. So yeah, I think that's about it. That's about it on cervical cancer screening or Pap Smear. So if you have questions, if you have something that you're not sure of, if you want clarity of something, comment and just ask me. If you want me to do a video or something, comment and just ask me. If you go on my about on my YouTube channel, there's so many people making noise outside. If you go on my about on my YouTube channel, you will see I have my Facebook and my Insta there. I have my YouTube and my Insta attached there. You can just go on both or any of them. Just send me the questions, everything like that. I'll be more than happy to answer. If there's something that you feel I didn't touch on this video, ask me, comment, do anything. Share this with your loved ones if they want to know more about pap smears and everything like that. So I'll see when I'm gonna do the next video. Obviously, I think it's gonna be a health one as well. So thank you guys for watching this far, and thank you for bearing with me for this unprepared video, and I hope to see you guys in the next one. And also, guys, take care of yourself, take care of your reproductive health, make sure that you are safe, make sure that you take care of you, make sure that you are good, guys. Make sure you're good, because at the end of the day, some of the things some of the things, guys, some of the things, you the one who has to deal with them, you as a woman. So take care of yourself, make sure you're good, make sure you make your checkups, all those things. Take care of yourself. So yeah, that's about it on my video. I hope you guys enjoyed. I hope you guys learned a whole lot of things, because I believe I learned. And also, I'm going to answer your question on the HPV. Was it HPV? Yeah, I think it was. I'm going to answer your question on the HPV on the description box. And then we are good to go. Thank you guys for watching thus far. And I'm looking forward to hearing from you. I don't know why my hands are doing this, because wow. Okay, fine. Anyway, from me to you, much love. Thank you guys, and have a good one. See you on the next video.